Hello everyone, I am Carrie Adkins, Sweetwater County Public Health in Sweetwater County, Wyoming. I am coming at you again with another lesson for your Reducing the Risk curriculum. In my contraception video, I talked about barrier methods of birth control, and today I am going to talk about those specifically in this video. Barrier methods of contraception are designed to put a physical barrier between partners, and this is to decrease the risk of getting a sexually transmitted infection or sexually transmitted disease. Also to decrease the risk of passing these things on to your partner. Now, these cannot eliminate your risk. We know that the only 100% effective way to not have a risk of these types of infections is to not participate in any sexual activity. That includes vaginal, anal, and oral, as all three of those types of sexual activity can result in the transmission of STDs. The first barrier method of birth control that I'm going to talk about today is a dental dam. Dental dams are just a thin piece of polyurethane, and these are actually designed to be laid over the genitals, the vulva, or the anus for the purpose of oral stimulation. It's really just like a stretchy, thin piece of rubbery type material. And this is to prevent the transmission of STDs from the genitals to the mouth. So we know that chlamydia and gonorrhea can get into the throat. We also see genital warts in the back of people's throats and genital herpes that are on people's mouths and mouth herpes on people's genitals. We also know that the #1 cause of oral pharyngeal cancers is HPV, or human papillomavirus. Oral pharyngeal cancers are cancers of like the back of the throat all the way up and down. And 70% of oral pharyngeal cancers are linked to HPV. Dental dams do work really well in covering that area. However, they're kind of difficult to find. I have not seen them at any of the stores around here. And so if you can't find them, you're welcome to come into Public Health or Western Wyoming Reproductive Health at 333 Broadway in Rock Springs and get those for free. Also, if you just don't have one available, another option is to just take a regular male latex condom and cut the top off of it. And then you can just cut it in half while it's still rolled up and unroll it. And while it's not the same size necessarily as the dental dam, it does create a decent surface area coverage to use for that purpose of oral stimulation. Now, you wouldn't want to use a dental dam or a condom like this on a penis. It wouldn't actually give you the protection that you need. If you were going to perform any sort of oral stimulation on a penis, you would want to use a regular male latex condom. We also know that it's very important to use condoms with any sort of anal intercourse. Anal intercourse has an increased risk of tearing, and with tearing comes bleeding, which increases the chances of getting STDs that are transmitted through blood. This is why people who participate in anal intercourse have higher rates of STDs like HIV and hepatitis C. Another barrier method is an internal or female condom. This is a condom that is latex free, and it is designed to be inserted into the individual using it. And it actually hangs out around the perineum like this. This does provide extra protection against blood transmission during anal intercourse. It also is just a great method for people who have latex allergies. These are quite difficult to get a hold of, if you need them, please come ask for them. Also, they're available by prescription. Now we're going to move on to talking about the regular male latex condom. We spend quite a bit of time on these, and there are a few different reasons why we do that. First of all, these are very easy to get your hands on. They're very accessible throughout the community, and they're also quite affordable. Condoms can be purchased at any grocery store or a gas station, feed stores. They're kind of all over the place. We also have condoms available for free at Community Nursing and Western Wyoming Reproductive Health, and you can come in anytime and get these. Even now, during the pandemic, you can come to our door and call the number, and you can just ask for condoms or an envelope or a bag, and we will bring these out to you at our door. We have thousands of these in our building, and they are here to be given out for free for proper use. Besides abstinence, condoms are really the only control that a person with a penis has over their reproductive health. When I talked about contraception yesterday, really everything became the responsibility of the person with a vagina, and all of those things were to prevent pregnancy. None of those things prevent STDs. Condoms, barrier methods, those are really your only protection if you're choosing to be sexually active. And of course, only abstinence is 100% effective. Condoms are the second best if abstinence is not the form of contraception that you're choosing. Another reason why we talk about condoms is because condoms are 98% effective with perfect use, but only about 82% effective with typical use, which means a lot of people are using condoms incorrectly. We want you to have the information to use these correctly because we want to give you the best chance of reducing your risk of getting STDs or of pregnancy if that's not something that you are wanting at this point in your life. Using a condom correctly starts before you even open the condom. First of all, condoms need to be stored correctly. They can't be left somewhere that's really hot or really cold. You can't leave them in your glove box. The temperature can damage the packaging, which would damage the condom. You also can't just put it in your wallet, somewhere that gets a lot of friction, because again, it will damage the package, which will make the integrity of the condom questionable. What you want to do is store it somewhere that's pretty temperature safe. You don't want to throw it in the bottom of your bag or your purse, because after it gets smashed over and over, you can see problems with the condom. We have tins like this at Community Nursing that are free. You can absolutely ask for them, and these store about 5 condoms in them, and then you know at least that your condom's not going to get smashed. You just want to make sure that the temperature you're storing it at is still appropriate. Also, all condoms should come with a warning on them. Even if you buy them in a package where they're all connected to each other, each individual condom has a warning, and it should say something along the lines of, when used properly, latex condoms are intended to prevent pregnancy, HIV/AIDS, and many other sexually transmitted diseases, though this cannot eliminate the risk. If your condom doesn't have a warning like that, it means that it hasn't been tested or approved to actually provide safety from STIs and STDs. There are some condoms out there that are meant to be novelty condoms. Maybe it's an American flag or camouflage with some cute saying. If it doesn't have this warning, it means that it wasn't actually tested to do the thing that you wanted to do, which is to protect you against STIs. So if you don't see this, don't use the condom. Another thing that you want to look at with your condom is you want to look for an expiration date. This one expires June 30th of 2022, so it's not expired. Condoms are usually manufactured about 4 years before their expiration date. So if you have an expired condom, it really does need to be thrown away. It was made 4 or 5 years ago, and it's no longer going to be able to do what it is designed to do. So now that you know that your condom was stored correctly, you have that air puff when you push on it, it has your FDA rating, and it isn't expired, you're going to go ahead and open your condom. Condoms have like perforations. You can see this perforation here. You always want to tear on the perforation, and you do not want to use your teeth or fingernail clippers, scissors, anything that's sharp. Anything that could cut the package could also cut the condom, and certainly you don't want to do that. Once your condom comes out, it's going to come out one of two ways. It's either going to come out with the rim rolled inside it, looking like an elf hat, we say, or it will come with the rim on the outside, looking like a sombrero. If it comes out like an elf hat, it's actually inside out. And what you'll find is if you put it on the tip of the penis and go to roll it down, it won't roll down. Now, if this happens and you just like flip it over and then put it on the correct way and roll it down, all the pre-ejaculate that we talked about in the contraception video is now on the outside of this condom that you're about to insert into your partner. So it's very important that if you put it on inside out, that you either try to MacGyver it on that way or you throw it away and use a different condom. So I have my sombrero, and at the top of this is what's called a reservoir tip. Most condoms do have a reservoir tip at the top, this right here. Some do not, and that's okay. What's important is that you leave room at the top of the condom when you put it on. For ones with a reservoir tip, you can actually use it when you are putting the condom on. You can hold on to the top, just pinch it, put it on the head of an erect penis, and just kind of hold it and roll the condom down all the way to the base of the penis. If you kind of have it up like this, then during intercourse, your partner's body could grab it and pull it off, which you definitely don't want to do. So you want to have it go down as far as you can possibly get it. Also, you want to remember to keep that tip up here. If you were to pull the condom on really tight, see how it just thinned out my condom? This condom is going to tear. So really important that you make sure that there is room at the top. Once it has been used, the partner who's wearing it will reach down when the penis is still erect or semi-erect and find the rim of the condom, this right here, and hold on to it as they pull out of their partner. If you don't hold on to it or you wait too long and the penis is quite soft, it's very possible that the condom will just slide right off into your partner and spill the contents inside your partner, which sort of eliminates the whole point of using a condom. So please make sure that you reach down, find that rim, pull it out. Then you'll just pull it off. You can try and keep the contents of it inside, and you will just tie it in a knot and throw it away. It is really important that you do not flush condoms. We see sometimes people flush condoms because they don't want people to know they're having sex. They want to flush the evidence away, which works until your mom has to call the plumber, and the plumber comes to your house and removes a bunch of condoms from your plumbing, and then your mom now knows that you're having sex and she has a plumbing bill for $800. If you're in a place where you're uncomfortable throwing it away, feel free to just wad it up, put it back in the package that you have, and put it in your pocket, take it and throw it away somewhere where you're comfortable. Also, condoms are single use. I don't really think that you're going to rinse it out and use it again tomorrow, but really they can only be used for one ejaculation. So if you're using it and you've used it once and then maybe you or your partner thinks that they can go ahead and go for round two, it's really important that you change condoms in between. Condoms are not designed to withstand friction from multiple sexual encounters, so please make sure that you're changing these. Also, occasionally we'll hear people say their partner told them that they couldn't use a regular condom because they don't fit them, because they're too small for them. And so we always just kind of put it on our hand and show you that this condom fits very well on my hand. Certainly it may not be as comfortable for someone to use a size that is more restricting than another, but definitely it's an option. If your partner says that they can't use a condom because they don't fit them right, then either you could choose abstinence that day, or you could go to the store and get the correct size of condoms. Condoms also can't be used two at a time. You can't wear two to be extra safe. The friction will make both of the condoms break. And you also can't use an internal condom with a male latex condom. Again, that friction will break the condoms. This condom is lubricated. Lubrication is really important when using condoms. Friction is the enemy of condoms, and sex involves a lot of friction, so lubrication is incredibly important. And when you're looking at lubrication, it needs to be a water-based lubricant. You cannot use anything oil-based, so no Vaseline, no like natural remedies like coconut oil or avocado oil. Things like that are oil-based, and oil will actually destroy the condom. So very important that you use lubrication that you buy really in the condom section, that's a water-based lubricant, so that it won't damage your condom. The other thing we know is that when condoms break, usually the person wearing it does not know that it broke until they are done and they've removed themselves from their partner, at which time they realize that they're missing pieces of the condom. When this happens, it's really important to communicate with your partner that the condom has broke, and always remember that if a condom breaks, Plan B is a great option to hopefully avoid the risk of pregnancy from a broken condom. And again, Plan B will block ovulation, so as long as you haven't ovulated, Plan B will effectively stop a pregnancy. If you have ovulated, Plan B is not an abortion pill, and it will not keep you from getting pregnant. So with that, I will conclude my video on barrier methods. Again, just remember that condoms are available at community nursing in Western Wyoming Reproductive Health for free if you need condoms. If you have questions, please go ahead and submit them to your health teacher, whatever you need to do so that I can get those questions answered for you. And hopefully I'll see you again in another video.